Hey guys, today's class is going to be focusing on lumbar rotation. We're going to do some PAILs and RAILs in rotation. We're going to need a stick. We're going to need some weights and some yoga blocks in this class. Let's give it a go. Okay, let's do a little bit of a warm up in rotation, holding our broomstick in front of us like this and slow and controlled rotating. You can rotate the hips. We want to irradiate or full body contraction about 20% here. I want you to just slow and controlled into rotation. See where your body will take that rotation at the moment. Give our nervous system experience in our outer range in rotation to prepare ourselves for our PAILs and RAILs. Okay, last one. Great. Okay, trunk rotations. We're laying on our back for this one. We're bringing our legs up into 90 degrees and we're going to be rotating to each side. So if this is difficult for you, place a blocks to limit your range of motion depending on where you're at. Otherwise, remove the blocks. You don't have to have weights to do this. Breathe in and irradiate about 20%, and we want to go to each side. Slow and controlled. Okay, and last rotation. Fantastic. Okay, let's do PAILs and RAILs for our lumbar spine in rotation. We want to get on our back on the floor. We're going to set up our stretch by holding onto a weight or something that you can hold onto and bringing your leg across, getting your spine into rotation, finding the line of tension. Now that may be up here for you. You just position yourself to where you find the best line of tension. We're placing our hand on our thigh, bringing ourselves into our passive stretch, and we want to bank 2 minutes in our stretch. Primary principles of our functional range condition is we need to get our stretch for ideally 2 minutes. That allows adaptation and re-education of the tissues. It allows us to be able to then do our isometric contractions in our passive range. That's then going to open up space and mobility health. And mobility health is when you have full range of motion and active control. And we want you to have active control in your best possible range of motion. So feeling the stretch there. We want to do some breath work here, and we want to hold this stretch for 2 minutes. Let's go through our PAILs and RAILs. My PAILs contraction is going to be doing this rotation. I really want you to focus on the rotation of your lumbar spine and pelvis and not pushing your leg up into my hand here. So we want to do an isometric contraction. We're pushing our legs up towards the ceiling, but we're focusing on that rotational part, pushing into my hand and focusing on rotating the spine this way, up towards the ceiling. Our rails contraction is going to be the opposite contraction. We're going to contract all the muscles, our obliques and our abdominal muscles to rotate the spine and bring the thighs or legs into the ground. And we're going deeper into the stretch. And we're going to hold it best effort and safe contraction. So I'm going to count you in 3, 2, 1. We're rotating the spine up towards the ceiling. We're pushing our legs down with our hand, and we're getting in a safe, best effort contraction. 3, 2, 1, opposite contraction. We're going deeper into the stretch. We're trying to rotate our spine using our obliques, abdominals into the ground. 3, 2, 1, bring it to that new stretch. This is a 45-second stretch. Again. And I'll count you in for our PAILs and RAILs. So we're going to do 2 sets of PAILs and RAILs. You can do more sets. You also want to make sure it's a safe but best effort contraction. Don't go into any sharpness or pinch points. Okay, I'm going to count you in another 5 seconds again. We're pushing your up towards the ceiling. 3, 2, 1, and push up towards the ceiling. Focus on that rotation of the spine. We're pushing up into my hand here. Keep going, keep going. Push 3, 2, 1, opposite contraction. We're rotating our lumbar spine. We're pushing our knees into the ground. We're making our thighs lighter off my hand here. 3, 2, 1, and relax into the stretch. That one there is generally a crampy one. If it's a cramp you're feeling, just back off that contraction. We don't have much experience going into that range or active control there. We're trying to retrain your nervous system to lay down receptors and have more spatial awareness in that range. Okay, it's 45 seconds here. Okay, I want you to slowly come out of that base. Rotate and recover, because we're going to go to the other side now. All right, just pop my timer on the other side. Reset that timer. We're now going to find our stretch to the left. Okay, find our stretch. I'm going to put our timer on. We now passive stretch. Find that rotation, and let's do some breath work here. Make sure you're comfortable. Two-minute stretch. The reason why your nervous system doesn't open up space is because of past injuries, scar tissue. Your nervous system feels unsafe in that area. The other reason why your nervous system won't give you with your range of motion is if you don't use it, you lose it. You just don't have any awareness there because you haven't been there for a long period of time. The other reason is that the nervous system perceives that the tissues are weak. So by doing these bases, contracting in an isometric way in our end range helps the nervous system to retrain, feel that it's safe that in that area. We're starting to go try and get active control in this range so the nervous system can adapt and make changes. Okay, I'm going to count you in about 25 seconds. The PAILs contraction is going to be rotating the spine to the right. We're going to be pushing a leg up into my hand, but I want you to be concentrating on the rotational component. Okay, 5 seconds, 5, 4, 3, 2, 1, pushing into my hand, focusing on rotation of the spine. Really focus on the obliques and the abdominal muscles to rotate your spine. 3, 2, 1, opposite contraction. Try to push your legs down into the ground. We're pushing deeper into that stretch. We're rotating the spine, focus on the rotational component. We're trying to make my legs lighter off this hand. 3, 2, 1, and relax into that stretch. 45-second stretch. Breath work. Right, ready for our next PAILs contraction. 3, 2, 1, pushing and rotating up towards the ceiling to the right. Building up to best effort, safe contraction. Really focusing on the rotational component of it. 3, 2, 1, opposite contraction. We're rotating to the left, pushing our legs down into the ground, focusing on that rotational component of it. 3, 2, 1, and relax. We're going to find our line of tension. A 45-second stretch. Okay, 3, 2, 1. Let's slowly come out and just recovery, moving around. This one, we're going to have our spine up against the wall. We're going to go into posterior pelvic tilt so we can feel our pelvis, and we're going to flatten our lumbar spine here, where our legs will be about 30 centimeters away from the wall here, knees slightly bent, and we want to bend into flexion here. Go down, keeping the pelvis onto the wall, and then we want to rotate as far as we can to the right and to the left, slow and controlled. Keeping the pelvis flat up against the wall. Last one. Okay, spinal cars or controlled articular rotations. I want you to hold our yoga block in front of you. We want to breathe in and radiate 20 to 30%. We're going to go into flexion, rotation, laterally bending, extending. We're just moving from our thoracic and lumbar spine, slow and controlled, searching for the best possible circle. Sit. Good, 2 more reps. Good, last one to the right. Finding that best possible circle and rotation. And back down into flexion. Now we're going to change directions to our left. Breathe in and irradiate. Rotate, laterally bend, extend. Pushing into the yoga block so that we're getting tension throughout the body. Coming into flexion again, last one. Let's make this our best one effort yet. Slow and controlled, finding the best possible space and coming back down into flexion. Great. Okay, let's do some spinal segmentation. We're going to use some yoga blocks, placing our elbows on the yoga blocks. We're really going to be focusing on the lumbar spine here. So start off an extension, then we initiate from that lower back into posterior pelvic tilt. Pushing up into flexion, looking down towards your knees, squeezing up. And opposite direction into anterior pelvic tilt, into extension. And keep going, really focusing on that lumbar spine. Okay, last one into extension.